Welcome to the Make a Mental Note podcast, where mental health professionals share information and perspectives that illuminate, educate, and is worthy of a mental note. And now your host, Chris Quarto.
Hi, everyone. This is Chris Quarto, and welcome again to the Make a Mental Note podcast. My mental health tip for today is to beware of confirmation bias. Have you ever heard of that term? Well, confirmation bias is a human tendency to seek out or favor information that confirms your beliefs or opinions and discounts or even ignores opposing viewpoints. You know, I have many friends who are liberal in their political views, and so they listen to left-leaning political commentators like Bill Maher or Rachel Maddow on MSNBC. And it makes them feel good because their views have been confirmed by these people. You know, it makes them feel like they're right. And so it's hard for them to understand why people would have a different take on issues. And of course, I also have conservative friends who swear that Fox News is really fair and balanced. Well, the problem, of course, is that people are either lazy or feel threatened and don't want to listen or search for information that doesn't agree with their views of things. And so they automatically discount facts or alternative points of view that fly in the face of their beliefs. And, you know, this is the kind of stuff that contributes to problems in relationships. So my challenge for you this week is to get off that well-worn and beaten path and be open to looking at an issue from a different perspective. You know, whether it's the Muslim issue, gun control, gays and lesbians, abortion, you know, you name it. And even consider seeking out information that goes against your beliefs and see what you come up with. So in other words, challenge yourself to be a little more objective and to understand why others might have a good reason to view things the way that they do. And that's my mental health tip for the day. Okay, let's get to my interview with Meshon Dugan. Well, today my guest is Meshon Dugan, and she is a licensed clinical social worker in Murfreesboro, Tennessee. And Meshon, welcome to the podcast.
Thank you, Chris. I appreciate you having me.
Well, I'm glad that you were able to join me today. I usually start off the podcast by asking my guests to tell a little bit about who they are and what you do for a living. So tell us about yourself, Meshon.
Well, I am a licensed clinical social worker, and I've been in the field of social work for about 8 years now. Mm-hmm. I now work in private practice as a counselor and therapist here in Murfreesboro. Uh-huh. I opened my office about 3 years ago in 2012. I work with individuals and couples age 18 and above, and mostly with people who struggle with anxiety and depression, anger issues, and relationship problems.
Okay. What kind of work were you doing prior to the private practice, Meshon?
Well, I was an inpatient social worker for the VA Medical Center here in Murfreesboro. Uh-huh. And at that time, I worked with largely veterans, older veterans who had suffered a stroke, or they were in for a knee replacement or something like that. It was a physical and rehab unit at the VA.
Okay. All right. So you've had that kind of background, and I'm sure that those types of experiences, I'm sure that they had some issues with anxiety, certainly. And
definitely.
And I would imagine that having that kind of experience really is something that helped you in your private practice.
Yes, it did, because many of those veterans were experiencing life-changing events, and for the first time, especially if they had a stroke, or and many times they were still working, you know, and then all of a sudden they found themselves where in a situation where they could not work any longer and maybe even needed disability benefits.
Yeah. And that's got to be so difficult for not only for veterans, but just anybody who has to cope with an adjustment, a big adjustment like that an adjustment oftentimes that can have life-changing consequences. And I'm sure you saw a lot of that in your work at the VA. Now, here in your private practice over the past 3 years, have you found that you're dealing with people who not only have anxiety, but other types of problems as well?
Yes, their depression is a common problem, and it's a relationship conflict. I see quite a few couples, so I'm finding that that's very common.
Okay. And I'll want to get into that with you a little bit more in a few minutes, but I'm kind of curious about, why is it that you decided you wanted to go into the helping profession? I mean, there's so many different things that people can do, but you decided to go into social work, and I'm kind of curious about why that was. Why did you go into this field, Meshon?
Well, when I was younger, I was like a lot of young people. I thought I was invincible. I thought that, I only needed family and friends as far as emotional support.
Uh-huh.
But then I had a crisis, a personal crisis in my life, and I became very depressed, and just to the point of thinking I didn't want to live anymore.
Okay.
And I had everything to live for, but I couldn't see that. So that's when I decided to contact a therapist, and I did go for therapy, and it really changed my life in a positive way. So, that was just part of when I experienced that. I really became interested in that field.
I think that's pretty common. We've had guests on here and who have had similar experiences as you, Meshon, that they've had some sort of personal issue or personal crisis at some point in their life, usually earlier in their lives, and based on those things, they've decided that, I need to get some help and do something about this. And through those experiences, they found that, I really appreciate the help that I got from a therapist. I would like to kind of pay this forward, to give back, and maybe I can do this too. And mental note takers, this is something important for you to think about, that perhaps that you're struggling with something personally, like Meshon was when she was younger, that maybe that this is something that you can get help. It's one thing to talk to family members and friends about this, but sometimes that's not enough. And oftentimes we need professional help to get us through personal crises in an effective manner. And Meshon, I think that, when you see these clients, I wonder if you find that there are common themes or stories that tend to underlie the problems that they have. I mean, what's your take on why people have the problems that they do?
Well, quite often I talk to people who have trouble setting personal boundaries. They say yes to requests when they really want to say no.
Uh-huh.
And what I see there are some underlying feelings of guilt that play into that need to always say yes.
Mm-hmm. Why is that? Why do you think that is, Meshon, that people have difficulty saying no and they'll just kind of go along with something when they really don't want to? I mean, why do you think that's the case?
Well, sometimes the people just hate confrontation, but I think more often because of past mistakes they've made, and we've all made mistakes.
Yes.
but because of past mistakes, they feel like sort of if they say yes, then they can kind of redeem themselves.
Uh-huh.
I see this sometimes with parents who have older children, and the parents have made mistakes in the past, and then then as the children get older, they can't set those boundaries because they're trying to kind of redeem themselves.
Mm-hmm.
And
yeah, and like you said, there's that guilt factor that figures into that equation too. So so what happens, or what have you found that happens if people can't set those boundaries, that, they just kind of keep going on, they never say no, or they never say yes, whatever the boundary issue is? What happens if they continue doing that?
They generally become angry and frustrated.
Mm-hmm. Mm-hmm.
And then, yeah.
So angry and frustrated, and then what happens with that? I imagine that could impact the relationships, couldn't it?
Oh, definitely. Yes.
Mm-hmm.
Of course, when anger is not managed and expressed correctly, that's when we tend to blow up, and it becomes a hurtful situation.
Mm-hmm. Is it hard to work with those types of people? I mean, I'm sure you've had those issues where people have difficulty setting boundaries, or they have those anger issues. Have you found it difficult to work with them, and how do you deal with those types of people?
Well, yes, it is difficult sometimes because I've had clients say, yes, I know I need to be assertive and I need to set this boundary, but I feel so guilty.
Mm.
And so I think that's been kind of a hurdle, is to help people get past feeling guilty.
Mm-hmm. Right. So if they are assertive, or if they start to set boundaries, that might be good for them in the long run. But the thing that really stops them from doing this is those guilty feelings.
Yes. Yes.
In mental note takers, I wonder if any of you are experiencing what Meshon is talking about here, where there's something, whether it's feelings of guilt or feelings of shame, doubt, all those negative types of things that we all experience from time to time, but maybe you experience them more often, and it's stopping you from moving ahead in life, from being where you'd really like to be. And Meshon, when you deal with these people, you must have some ways of helping them get past these hurdles as you describe them. And what is your approach to helping people deal with these types of issues, or other types of issues, whether they're dealing with anger, or whatever the issue is? Do you have a particular kind of a recipe for success in helping people kind of move from that initial place where they're at when they come in to see you, to the point where they've been able to make these changes and they don't need to see you anymore? What's your recipe for success?
Well, a very basic tool that I use is to validate a client's feelings or their concerns.
Mm-hmm.
When people have problems and they express those to a spouse or to other family members, sometimes those feelings and those concerns are negated or discounted.
Mm-hmm.
And we sometimes hear statements like, "Oh, you shouldn't be upset about that," or "A lot of people have worse problems than yours."
Mm-hmm.
And clients will tend to feel like and begin to then negate their own feelings and thoughts. and that's not good for our mental health. So what I do, the probably one of the basic things I do is to validate those feelings and concerns that my clients have.
In a family, one person may hear these negative messages from another family member that kind of discounts their feelings, and as you put it, negates their feelings. And so if they hear this, if the person hears this enough, they start to, I guess, listen to these tapes in their head and start to believe that my feelings don't count for anything, that I'm really truly not a worthy person. And part of your recipe for success is to have them come into a different environment, the therapeutic environment, and for you to basically do the opposite, to validate their feelings. Is that what I'm hearing you say?
That's correct, yes.
And so a real important part of your recipe for success is the validation part, where a person starts to understand, you know what, maybe my thoughts are important. Maybe the way that I feel about things shouldn't be negated, that maybe there's something to this. So as you start to work with these people and you validate their feelings, are there other things that you do, Meshon, that kind of helps them along that path toward success?
Well, yes, I try to equip my clients with some tools, and so that they can start to use those tools, because, and then when they do, they can start to see some success. Clients often blame their problems on the people and the circumstances around them, and I think that takes the focus off where the focus should be on their own attitude and their own approach toward other people and toward other situations. So I think that people are more likely to commit to change when they understand the power of changing their own attitudes and behavior. And when they start to make those changes and they start seeing positive change, then, that's when they're moving in the right direction.
Yeah, and I think that, some of the things that kind of help, in addition to the validation of feelings, is to equip them with tools, and I want to ask you about maybe one of those tools that you use in a second, but also helping the client understand that, you know what, there's only so much that you can do to change other people, and that's really not the focus anyway. The main focus should be on what can you do to change you, because you don't have control over other people, or maybe you don't have much control over them, but you do have control over the way that you kind of think about things, or the way that you see things. And helping people understand that gives them, I guess it empowers them, doesn't it, to really believe that, you know what, maybe there is something I can do.
Yes.
And that really helps with the motivation, doesn't it?
Yes, it does.
Yeah. So these tools, you said that you equip them with tools, and I like that because I kind of approach that in the same way with my clients, Meshon, where I kind of look at as clients as capable of learning and of incorporating things that they've learned into their lives to make their lives better. And there are a lot of tools that we can help equip clients with. So what's a tool that you use that you found to be helpful, as part of this recipe for success that we're talking about?
Well, I think one thing that's critical for us when we're making change is to look at our inner dialogue with ourselves.
Uh-huh.
And all too often that is a negative dialogue. And one thing I do is teach my clients about reframing a thought.
All right.
And by that I mean taking a negative thought such as, I'll never be successful, or I could never go to college and get this degree. And I suggest that they break that down into some bite-sized pieces and look at it from the perspective of, I could sign up for one class. I could try one class and see how it goes. I can make that much commitment, and if I like it, then next semester I can sign up for 12 hours. So it's just to help them reframe the situation into a more doable type situation.
I think it's interesting that, when you see clients, sometimes they're not even aware that they have these dialogues that you were talking about, these negative thought patterns or dialogues, things that they say to themselves, that they're not even aware that they do that. And I think part of therapy, part of the recipe for success, is to not only help them become aware of those tapes or those dialogues, those inner dialogues that they have, but maybe to help them look at things a little bit differently. And you kind of talked about this as the reframing, that, maybe there are different ways of looking at things. Maybe it's not always my default negative way of looking at something. Maybe there's a different way of looking at this. And you know what? I think that it kind of goes back to the whole empowerment thing, that if you can help clients look at things from different angles, different perspectives, it helps get them unstuck. And it kind of helps them feel empowered that, wow, I've never really thought about it that way. Maybe I can go to college, or maybe I can do this, or maybe there is a different way of looking at this. But they've been in these patterns for so long that they're either not aware that they're thinking this way, or that it's tough to get unstuck. And I'm sure that there's a whole process in working with clients and helping them to get to that point of looking at things a little bit more positively. So now you've probably worked with clients who are challenging as well. I mean, there are some clients who come in that, want to change, but change is not always easy. And share with the mental note takers some of the challenges that you've experienced working with clients, Meshon.
Well, probably some of those challenges have been with couples.
All right.
Couples who have developed poor patterns of communication with each other. And, what I try to do is help them regain an emotional connection, for one thing, an attachment, but also try to just give them some tools to learn for communication, because I've seen so many times with couples that they will have conversations and they can't have a conversation because they interrupt each other.
I see.
So something as simple as reminding them and training them to not interrupt each other can really enhance the communication, but if they're not aware of it, then they're never going to change that.
Right, and I bet that as you're working with couples, you probably see a lot of that dysfunction right in front of you, don't you? I mean, the interrupting or the blaming, or whatever the case is. And that can be very difficult. Do you ever find that when you do the couples work, Meshon, that there's one member who's willing to make changes and the other isn't? And if so, how do you deal with that kind of a situation? Well,
actually, that is the situation most of the time.
All right.
one person is really wanting to save the marriage or stay together, and the other person is at the point of calling it quits.
Mm-hmm.
And when you're I'm only with a couple for 45 minutes or an hour or so. It can be difficult to kind of try to change the perspective of the person who's ready to end the relationship.
Mm-hmm.
But I would say my first step, the very first thing I do is to find out if they are both willing to work on the relationship for just 6 months.
Mm-hmm.
And try to get a certain amount of commitment from both of them for 6 months or a year. But so I think that's probably the first thing I do. And then, as you were saying, I do observe some unhealthy patterns even in that session. And to have a mediator there who can say, okay, wait, let him finish saying
Mm-hmm.
what he's saying, and then it'll be your turn. Just to make them aware of that, not to come across like I'm disciplining them, but
Mm-hmm.
just to give them direction, and hopefully that gives them some insight.
Mm-hmm. Yeah, and I think that kind of gets back to what we were talking about earlier in helping people become aware of what's going on, because this is something that they may have been doing in terms of their pattern of communication. This is typical for them. I mean, they don't know any better, and to have that outsider's perspective on what's going on helps them
Right.
become aware of something that they really weren't aware of in terms of damaging their relationship and just making matters
Right.
worse. So I agree. I think it's really helpful in these challenges that we're talking about to have a third party there to point out some of these things to help them become more aware of those dysfunctional those patterns. In the work that you've done, would you say that the most challenging work is with couples, or is it with different types of clients? What would you say along those lines, Meshon?
I would say that the most challenging work has been with couples.
Mm-hmm.
When you're working with an individual, you have that one-on-one impact that I think is easier sometimes. With couples, one thing about couples is that they normally do not call a therapist or a counselor until one of them is asking for a divorce, or one of them is saying, I'm leaving.
Mm-hmm.
So that is a challenge that you don't have with an individual.
Mm-hmm. Right. So in that kind of a situation, you're really walking up that big mountain, aren't you? That, boy, this
Yes.
is huge.
Yes.
And, it's almost at the point where, it's something that they should have done a long time ago. And this is a huge challenge, not only for them, but for you too. I mean, as the therapist, in helping them. And I would guess that part of that is providing them with some hope that, if you at least give it a chance, you've got a shot, but part of this is the buy-in, isn't it? That, that both of them have to buy into it. And, one person might say, yes, I'm in it. Let's do it. The other person is probably, I'm not really sure I want to do this. They're not quite as enthusiastic about doing this stuff. So I imagine that is, part of the challenge is getting that buy-in from the person who's really not big on the idea of doing this.
Yes, it is.
So there are a lot of different therapists out there that people can see when they're having these types of problems. And do you think that there are certain characteristics of therapists or therapy approaches that that really seem to resonate with clients, Meshon? I mean, what is it, that a person should be looking for in a therapist if they do need help?
Well, I once had a client tell me that she felt safe in her therapy sessions.
Mm-hmm.
And to a lot of people, that might sound like a strange statement. Like, they might ask the question, how could she not feel safe in a therapy session?
Mm-hmm.
And I think that's something that's very important. And what she was talking about was emotional safety.
Mm.
She had seen me enough times, and she had talked to me enough for enough visits or sessions that she knew I wasn't going to judge her or belittle her for any reason.
Mm-hmm.
So she felt that freedom to voice her feelings. And I think that is a very basic need in seeing a therapist.
Uh-huh.
And that is that with so many people in our lives, we don't feel safe expressing those things. And so I think that's a very basic need in seeing a therapist. And I would encourage anybody who is looking for a therapist to understand that we're not all alike, and they're not going to have the same fit with just any therapist. And if they would need to see somebody for 2 or 3 sessions anyway, I think, to know whether they were a good fit or not.
Mm-hmm.
I guess I would encourage,
Yeah, that's a really good point. I think that, I just want to make mention of your first point about the safety thing, and you mentioned that it's a very basic. It's true that is very basic, but it's so important for the reasons that you were mentioning there. That getting back to environment, if a person comes from an emotionally charged negative environment where they don't feel safe, and it's not a good idea to express feelings in that environment. Coming to your environment, which is safe, where it's okay, where they're not going to be judged, where whatever they say is okay. That this is new for a lot of people, that they've never had that kind of an experience before, and feeling that they have that sort of that safety net and acceptance is, I think, a critical part of what people look for in a therapist. And the whole notion of fit, I agree with that too. That sometimes, and I've had clients that I didn't feel like I've really had a good fit with, and I've had discussions with them about that, and we've had very open discussions about that, because it just doesn't happen automatically, and so I agree with that too. That sometimes you have to look for the right therapist that you fit with, whatever it is that you're looking for, whether it's that safety thing or, whatever it is, fit is certainly important. Now, at the end of these interviews, Meshon, I always ask guests about maybe tips that they could give to the audience to enhance their mental health. Do you have any tips or words of advice that you could give people if they're having difficulties, whether it's relationship difficulties or just general mental health difficulties? What's a tip that you could give to the mental note takers today?
Well, I think that would be to accept yourself for who you are and to be kind to yourself. I mentioned and that negative inner dialogue.
Yes.
That sometimes tells us we're not good enough or we're not enough.
Yes.
I would just say be aware of that inner dialogue and accept yourself for who you are. Mm-hmm. We all want to mature. We want to get better. We want to learn more. We want to grow, but accept yourself and the pace that you can go, and don't compare yourself to other people who are maybe moving at a much quicker pace.
Mm-hmm.
Yeah, that would be it.
Yeah, it's so easy to compare ourselves to others, isn't it? And I think that's just it's a human tendency, and I know I do it. And it's like, why do I continue doing this? There's not a need to do this. And I think that we could all benefit from that, Meshon. That we need to take a look at who we are, and none of us are perfect, and it's okay, And I think that. That's a work in progress. We're all works in progress, but I think part of the work in progress in this case is to continually remind yourself, it's okay that I'm not perfect. I'm okay the way that I am with all my faults, and this is who I am, and that's okay. Yeah, and I agree with that. That's a good point that you make there. Well, Meshon, if anybody wants to see you for therapy or wants to consult with you, how can they get a hold of you?
They can reach me through my email address, which is meshondugan@gmail.com.
Okay.
Or they can contact me by phone.
All righty. And what's your phone number?
It's 615-995-6347. And I do answer my phone myself.
Okay, great. Well, I really appreciate you coming on today and spending some time with us and telling us about who you are and your practice and all these issues that we've covered today. And I hope you have a great rest of the week.
Well, thank you, and thank you for having me.
Okay, thanks. All right, I appreciate Meshon coming on to discuss her perspectives on the therapy process. In terms of the mental notes takeaway from today's interview, clients benefit from therapy when therapists employ basic elements such as validating clients' feelings, equipping them with practical skills and tools, helping clients feel emotionally safe, and getting them to the point where they accept themselves for who they are as people. Now, here's my question for you. Why is it important for a therapist to validate a client's feelings? Well, some clients come into therapy thinking that they aren't important or what they think or feel isn't relevant. Meshon talked about how family members may actually negate the client's feelings by saying things like, "Oh, you shouldn't feel that way." Validating feelings is a basic element of successful therapy. It helps clients feel good about themselves. It lays the foundation for the difficult work that takes place in therapy. If clients don't feel validated, then they won't feel safe emotionally, and they're more likely to terminate prematurely. So that's food for thought. Okay, if you'd like the show notes from today's podcast interview, please visit my website, Quarto, ChrisQuarto.com. Also, if you like these podcast interviews, please get the word out on Facebook and Twitter. The podcast interviews can be found on iTunes and Stitcher Radio. It's so easy just to type in Make a Mental Note Podcast in Google. It'll take you right to iTunes or Stitcher Radio for past episodes. So please get the word out. Thanks again for listening, and have a great rest of the week.